Hello everyone and welcome back to my video series over cognitive behavioral therapy. In this video we will be talking about behavioral interventions and techniques and how they can be used in CBT. These strategies help individuals modify their behaviors to promote positive outcomes and emotional regulation. CBT emphasizes behavioral change as a pathway to improving thoughts and emotions. Behavior activation. Behavior activation is primarily used for depression, where there's a lack of motivation leads to inactivity. It focuses on encouraging individuals to engage in activities that provide meaning or pleasure, counteracting depression. For instance, if a client has been isolating themselves due to depression, you might suggest scheduling social outings or participating in enjoyable hobbies. This helps break the cycle of avoidance and boosts mood. Example, you schedule the small, manageable activities to help build confidence and motivation. You never want to make the homework or the activities too overbearing, overwhelming for individuals because they may tend not to do it. Next, we have exposure therapy. Exposure therapy is a technique used to reduce anxiety by gradually confronting feared situations, often in the controlled exposure to feared situations to reduce avoidance. So, for example, a client with a phobia of dogs might start by looking at pictures of dogs. Then they work up to visiting a dog shelter. Over time, exposure helps reduce the emotional response to the feared object or situation. This is typically used for anxiety disorders, phobias, PTSD, and OCD. The types of exposure therapy, we have in vivo exposure, so facing real life fears, so for example social settings. Imaginal exposure, so visualizing feared scenarios. And interoception exposure, including physical sensations related to the panic. So example could be breathing exercises for panic disorder. Next, we have relaxing techniques. So relaxing techniques such as the progressive muscle relaxation, the PMR, and deep breathing are essential tools for managing anxiety. The PMR involves systematically tensing and then relaxing different muscle groups, helping reduce physical tension. Deep breathing involves slow, controlled breaths to activate the body's relaxation response, reducing stress and anxiety. There's also mindfulness meditation, helping to stay in the present to decrease rumination and anxiety. In summary, behavioral techniques like activation, exposure, and relaxation are effective in addressing unhealthy behavior and managing emotions. Practicing these techniques daily is key to creating lasting change. Encourage clients to continue to use these tools between sessions to reinforce positive behaviors because as we learned in the previous video about the structure and homework in CBT, most of the work happens in between sessions. So it is crucial that these techniques are taught by the therapist for the clients as behavior activation, exposure therapy, and relaxation techniques are effective tools to reducing distress. And behavior shapes emotions and thoughts, so changing the behaviors can lead to improved mental health. And practicing the small, consistent behavior changes can help overcome avoidance, increase motivation, and all well improve the client's mood. Next, we'll take a look at cognitive restructuring. Thank you.